Hello, my name is Molly Horn and welcome to my case study presentation. In today's video, I presented a case on one of the University of Vermont's animal science horses, Sarah. Sarah was diagnosed with EPM last fall. I presented this case in December of 2017 to a class of around 55 students in horse health and disease, where I was a teaching assistant. In today's video, I presented my case to fellow equine science students who were unable to attend the initial presentation. My goal for teaching is to present horse health and management practices to students who have a desire to work in the equine industry. I have found that creating interactive case studies really involves students and simulates a real-world scenario in which they may encounter in a future career. I hope you enjoy this presentation on equine protozoal myeloencephalitis. Thank you for watching.
Hi everyone, my name is Molly. Thank you for joining me today. Today we're going to be presenting a case on Sarah, who is a 24-year-old Morgan mare, and our chief complaint is some overall general weakness and stiffness for about the past month, and she has been dragging her hind feet in the dirt. Upon physical exam, we have found that she is bright, alert, and responsive, and her temperature is 100 degrees Fahrenheit, which is within the normal range of 99 to 101.5. Her heart rate and respiratory rate is also within normal limits, and there is no obvious heat or swelling on any of her limbs, and she does have slight muscle atrophy noted on her right hind. You can see in this photo. This isn't Sarah, but this is just an example. Up here on the croup area, you can see that little divot of muscle atrophy. So just based on that physical exam, do you have any differential diagnosis? Yes.
Neoplasia.
Yes.
Lyme disease.
Okay. Any others?
Something maybe metabolic.
Neurologic.
Yeah, good. So, top of the list we have equine herpes virus 1, the neurologic strain. We have Lyme disease, a neurologic disorder, metabolic such as Cushing's, and then neoplasia, which is just new cell growth. What diagnostics do you think we should do for Sarah today, based on your differential diagnosis?
You can do a lameness exam.
Definitely probably a CBC chem.
Yep.
Just to check her overall cell levels, make sure everything's functioning properly.
Yep. Anything else?
I don't know anything.
So you had some of them, so we're going to do a CBC chem on her, and that came back within normal limits. And then we also did an easy test you can do at the barn when you're out there is steroid amyloid A, which was also within normal limits, and that is a good inflammation marker. And then we went ahead and did an orthopedic or lameness exam on Sarah, and she was positive to upper limb flexions in both of her hind limbs. She was also sensitive to palpation over her sacroiliac joint, and she was hypermetric in both of her hind limbs. Can anyone explain what hypermetric means?
It means when they bring their legs up really high.
Yes, good. Yep. And with the sacroiliac joint pain, Sarah does have a history of arthritis in that joint, so it is most likely unrelated to this issue today. And then we went ahead and did a neurologic exam on her. And her head and mental status was within normal limits, as well as her neck range of motion and her trunk. They were both within normal limits. For her limbs, she had decreased proprioception in both of her hind limbs, and that muscle atrophy again was noted on the right hind croup area. And then we went and assessed gait and posture. Just a minute long. So you can see with her hind limbs, she kind of leaves them out a little bit in an abnormal position. Typically a horse should bring it back right underneath them, so this kind of indicates that something neurologic might be going on with Sarah. And then what's going on in this video here, this clip.
She's not crossing her hind legs over like she should be.
Yeah, yep. And she's also bringing her outer limb out a little bit more, stepping out a little bit further than normal.
Definitely looks awkward.
And then this here, we did put a blindfold over her to see how she would do without her sight, to see if she knew where her limbs were in space. And you can see she is a little bit unsure of how to walk in a straight line when she is blindfolded. And then this test here, it's the same concept of removing sight, but we're just lifting her head up. And with her hind legs, she's a little bit unsure of where to place them. And then lastly, what test is this?
Sway test.
Yeah, good. So we're seeing if she's able to catch herself if I pull her off balance. And she takes a couple seconds to right herself. So with that neurologic video, what limbs do you think are affected?
The hind limbs.
Yes. Symmetric or asymmetric?
Symmetric.
And what does that mean?
It means that both limbs are affected equally.
Mhm.
Maybe one of them is affected a little bit more, but you see it definitely on both sides.
Yep. Good. And where do you think the lesion, in this case since it's neurologic, where do you think it would be located?
Somewhere on like the caudal side of the vertebrae, so like
Yep.
further back because it's not affecting the front limbs
Mhm.
or her like face or
Yep.
neck area.
Oh, good. So any further differential diagnosis and diagnostics for Sarah? And you can stick with some ones you had before as well.
You can do it Lyme tiger.
I'm not 100% sure.
So some further diagnostics is running serology, which would be doing a Lyme titer, and we can also do a Lyme titer for something called EPM. And another diagnostic route you can take, which is definitely more invasive, is a CSF tap. And this picture here, it's between the atlanto-occipital joint, which is definitely more invasive than if you pulled a CSF tap from the lumbosacral region. With the CSF taps, you can get a false positive reading. So we pulled a Lyme titer on Sarah, and the results are right here. And there are 3 different outer surface proteins that we're looking at. There's OSP-A, OSP-C, and OSP-F. Outer surface protein A tells us if she is fighting an acute infection. Outer surface protein C tells us if she's fighting a chronic Lyme infection. And then the outer surface protein F lets us know if she has the antibodies present for Lyme disease. All 3 outer surface proteins are negative, so we can rule out Lyme disease as a possible diagnosis for her. And then we have our EPM titer, and the results are down here. 1 in 1,000 is the number that we got, and the ranges 1 in 250 is a negative, and then up to 1 in 4,000 is high. And so she's kind of in a gray area where she's not quite negative, but she's not quite high. So based on our EPM titer, our diagnosis is equine protozoal myelitis. And can anyone tell me why it's myelitis versus a myeloencephalitis? Yes?
Because it affects only the spinal cord, whereas myeloencephalitis affects both the spinal cord and the brain. So where it's only affecting her hind limbs, it would only be found in the spinal cord.
Yes, very good. So EPM is a progressive degenerative neurologic disease, and the reservoir is birds, and the host is the opossum. And the horse can get this by ingesting contaminated feed. Say if a possum maybe died and somehow managed to be in a grain bucket and you fed that grain, or if they were in a bale of hay, that is a possible way for the horse to get EPM or be exposed to EPM. And horses are a dead-end host, so a horse cannot spread EPM to a human or to a dog. So anywhere between 22 to 65% of horses in the US are seropositive with the antibodies for Sarcocystis neurona. It just means that they've been exposed to it. It doesn't necessarily mean that they are positive for EPM. And the pathology of this, the lesions can be found in both the spinal cord and the brain, but as stated in the previous slide, this is a myelitis case, so the lesion is just found on the spinal cord. And this image here just shows the life cycle of the S. neurona protozoa and how it begins with raccoons and skunks, and then the possum is the host, and this is where the S. neurona protozoa matures, and then the horse ingests that protozoa, where it then infiltrates the nervous system and could potentially cause EPM. Telling the difference between a neurologic horse versus a lame horse can be difficult. Lameness is a clinical sign, not a disease, so if you have a lame horse, it can point in many directions, such as EPM or Lyme disease. And then you have your neurologic lameness, where you look for things like ataxia and incoordination, like we saw in Sarah's neurologic test. And it can point towards a bacterial issue or protozoal, such as EPM. And then with a musculoskeletal lameness, it's more predictable, such as a pulled tendon or like navicular. It's easier to have a treatment plan for that. As for neurologic lameness, it's more unpredictable with EPM, especially if the horse has been exposed to the S. neurona. You're not quite sure if they are actively fighting off EPM or not, and that's where the titer comes in handy. So what do you think our plan would be for Sarah in this case, since that titer showed us a gray area with the EPM?
Just preventative care and
Yeah.
like supportive care.
Yeah, good. So treatment plan for Sarah would be to give her an anti-protozoal, and in this case there is one on the market called Panazaril, and you have them on this medication for 4 weeks, and then after that you pull another EPM titer 2 weeks after the medication is over to see what the levels are, and in Sarah's case we would assume that they would either stay the same or even lower since she was in that lower positive range. And then you would also repeat that layman's and neuro exam to see if there was any improvements or she got worse. And like you said, to do supportive treatment and care, you can give her some NSAIDs for anti-inflammatory if she's sore or painful. You can give vitamin E and also thiamine. Vitamin E is an antioxidant, and both are great for neurologic support. Sarah's prognosis in this case is good. She is grade 1 to 2 neurologic and is not showing much progression or worsening in her signs or symptoms. And as stated before, you can pull another titer down the road to check her antibody levels again to see if her levels have risen or decreased. And there's a quote here, it just says that there are many horses that have positive EPM blood tests but do not actually have EPM. So Sarah's a great case and she is in that gray area. Pulling that titer will definitely tell you if she falls into this category or not. So before moving on to the next slide, does anyone have any possible preventative methods to prevent EPM down the road? Charlotte?
Maybe making sure that your grain and your hay is properly taken care of and you don't have any rodents or anything getting into it.
Yeah, it's a great step. Prevention of EPM, there is a vaccine out there. It's not commonly used by veterinarians and it is a killed vaccine. Yes?
Could you just clarify what a killed vaccine is?
Yes, so with vaccines you can have a live vaccine, a modified live vaccine, or a killed vaccine. And in this case the Sarcocystis neurona protozoa is dead or killed in this case, so if you inject it into Sarah, her body won't have to fight off a live infection and it'll be easier for her body to fight off the dead or killed virus, or protozoa in this case. And her body will still be able to make the antibodies against S. neurona to prevent EPM down the road. And as you also stated, some environmental preventatives are keeping pests off your property, keeping your grain buckets covered, checking and cleaning your water buckets out, and disposing of any animal carcasses you might find on your property. And that is it for Sarah's case today. Thank you everyone for coming, and I hope you enjoyed.
Thank you.
Thank you.